Namaskaram, hi everyone, and today we are being with Dr. Jyoti Goel, Director Critical Care and Academics, Metro Hospital, Faridabad, Haryana. Welcome ma'am to this NATCO studio powered by Indian Society of Critical Care Medicine. Welcome ma'am to this beautiful show.
Thank you so much. Thank you.
How are you ma'am?
I'm good.
Alright, so I do have some few questions to ask you, and could you please answer to this? And it will definitely help all the younger generation. So could you please answer to the all questions that will. Alright. So my first question will be, how does ceftazidime avibactam performed in treating hospital-acquired pneumonia caused by CRE? Could you please answer to this?
You are asking that hospital-acquired pneumonia caused by CRE, how the ceftazidime avibactam works. So it's a very important antibiotic, mainly indicated for treatment of CRE, whether it is hospital-acquired pneumonia or any infection, be it catheter-associated bacterial infection, bloodstream infection, or catheter-associated urinary tract infection, or just as a community-acquired pneumonia is also coming up with CRE group of organism. So for treatment of CRE, the first line of drug is ceftazidime avibactam, and most of the time, since the incidence of resistance and is increasing and the incidence of New Delhi metallo-beta-lactamases is increasing, so we need to, most of the time, till the time we get the antibiotic sensitivity report and antibiogram, till that time we usually combine it with aztreonam to cover for the New Delhi metallo-beta-lactamases. And as soon as if we get the sensitivity report and if the bug is showing sensitivity towards the ceftazidime avibactam, then we de-escalate it and we put the patient on ceftazidime avibactam only. So for empirical treatment, it is ceftazidime avibactam and aztreonam combination, and for the targeted treatment, if the sensitivity report is showing sensitivity towards the Cas-Avi combination, then we de-escalate it to, rather than going for the combination, we stop the aztreonam.
All right, thank you so much. Thank you so much for your answer, and thank you so much for sharing your wisdom with all of us. And I do have one more question, and which is, how does ceftazidime avibactam compare to meropenem in treating MDR infections? Ma'am, could you please answer that?
Yeah, this is straightforward question. When your bug is not sensitive to carbapenem, then only the role of this combination comes in. So if most of the time the resistance to carbapenem is increasing nowadays, and more than 50% of the bugs are becoming carbapenem resistant because of the excessive use of carbapenem, right, left and center, and because of empirical use of so many broad spectrum beta-lactamase and beta-lactamase inhibitor combination, the incidence of CRE is increasing. And if you are suspecting any bug which can be carbapenem resistant, then better to cover it rather than going for the meropenem. If your patient is very sick, straight away go for this combination, and then later, after getting the culture sensitivity report, you can always de-escalate it. So if you suspect any carbapenem resistant in your patient, start directly. You can start empirically with this combination rather than starting on carbapenem first and later, after getting the sensitivity report, then you might be very late. If your patient is very sick, he is hemodynamically unstable, he is in septic shock, then it's better to start straight away if the risk of CRE group of organism is very high.
All right, thank you so much, ma'am. And we are moving to the last and final question of this section. May I ask?
Yeah, sure.
Yeah. What are the clinical offline indications for using ceftazidime avibactam in the ICU?
In the ICU. Yeah, the same question again and again. The clinical indications are whenever there is a risk of carbapenem resistant organism is there, or whenever there is, you get the bug, you cultured the bug which is showing resistance to all the carbapenems, including meropenem, imipenem, doripenem, and ertapenem, then definitely you are, for the treatment of this kind of carbapenem resistant Enterobacteriaceae group, the drug of choice is ceftazidime avibactam combination.
All right.
Yeah.
So everyone, we are going to conclude this section with Dr. Jyoti Goel right now. By the way, thank you so much, ma'am, for sharing your wisdom. Thank you so much for your words. Thank you so much for sharing your knowledge with all of us. And we are going to conclude NATCO Studio Room powered by India Society Critical Care Medicine right now with Dr. Jyoti Goel right now. Thank you so much, everyone. Thank you so much, everyone, for watching us. Thank you, ma'am.
Thank you so much.